Hi, my name's Taylor. I'm going to be doing my IV test out today. So the first thing I'm going to do is come into my room and I'm going to read my nurse's note, and which I already did with my first med check. So I just want to say that throughout this whole video I'll be checking the 6 rights of medication. So that is right patient, right medication, right dose, right route, right time, right documentation. So it looks like the respirations are high, so I'll be giving one of my medications, and then he has a pain rate of 6 out of 10. Alright, so first thing I'm going to do is we're going to look at my sodium chloride bag here. So I have 0.9% sodium chloride on continuous IV, 500 mils, and it's May 2016. For the purpose of this test out, we were going to use it, but I wouldn't use it on a real patient. It's not an NSAID, and it's for my right patient, so this is good to go. So I'm going to set this right here. Next one I have is levofloxacin, and that's 250 per 50 ml bag of 0.9% sodium chloride. Okay, September 2018, that's good. And it is not an NSAID. All right, that one's good. Next I'm going to go to my hydromorphone, and that is 1 milligram per mil. So I'm going to do 1 mil of this in my syringe. Hydromorphone, 10, 10, 25, not an NSAID, and it's for my right patient and at the right time. Okay, so now I'm going to wash my hands here. Put on some gloves just to maintain everything sterile. And I need to, oh my gosh. I'm going to clean off my vial first for 20 seconds to make sure it's good. Alright, so I'm going to do 20 seconds here. 1, 2, 3, 4. You want to get it all around. Okay, so about 20 seconds there. I'm going to dispose of that. And then I'm going to go grab my needle here. If we were injecting in the patient, we would do a filter needle, but because we're going to be taking this off right away, I'll just use this regular needle. So I'm going to do 1 mil here, as it says on my MAR. Just put it in. We're going to push the air in, flip, make sure that this will stay sterile here. Okay. Get out my bubbles there too. Okay, so about 1 there. Alright, pull that directly out. Put my cap down. Put it on there and put it against a hard surface. Put that on. Okay, so this is my hydromorphone, and what I'm going to do is really quick, we're going to make my labels for everything. So I know I just threw out my hydromorphone, so we'll make that first. Hydromorphone, and then it is a 1 milligram per mil, and I have 1 mil in there. And then I'm going to do the date, which is 3/29/19, and my initials here. Alright, so this one's good to go, and I'm going to put it on here. And I'm just going to double check my vial against this here. So I knew I drew up 1 milliliter, like it says on there. 1 mil, okay. And then I'm going to set this over here just because I know it's done. And I did check the expiration date. It's October 2015, but again, we want the right whatever date. Oh, 10/10/25 on this one, so this is what we want. Not an NSAID, hydromorphone 1 milligram per mil. So we're good with this. This one's done, that's labeled. I have my saline flushes here, and then I'm going to do my tubing here quick. So we'll do 3/29/19. ITF, and then this one, 3/29/19 TF. So these are good to go. So second med check is done with all these, and then now I just have to do my saline here. So just because I touched all that, we'll just make sure my hands are clean. And then we are going to clean off the vial, even though there's a cap on it. And that is saline. It's not on our MAR, but we know that it's saline. So I'll just check the expiration date. And it looks like it is October 1st, 2017. So I'll just say it's good for now. And we wouldn't give it if it was expired. So I can throw that away. And I'm going to alcohol wipe this one for 20 seconds. One, two, three, 4, 5, 6. One thing throughout this video too, I'm going to be making sure to do is watching my medications and never turning my back on my medications. Okay, so about 20 seconds there. And now that's ready to go for the first one. So the first one I'm going to drop is 5 mils. 3 on this one will do. Okay. I need a 5 mil syringe for the next one. Alright, so I'm going to go directly into here. We're just going to push that 3 mils in. Keep it. Flip. Don't want to touch anywhere on that vial there. Okay. Okay, and we're at 3. So I'm going to flip this over, make sure to not hit that syringe there, and pull it directly out. And we are going to grab the cap. I did not throw that cap away. Okay, so since I don't have the cap, what we're going to do is just grab this one off of here, and I'll dispose of this needle into the sharps. Okay, just going to take that off. I'm going to set this down for a second. I will put it in the sharps here. Okay. So this one's good. And I just put on my saline here, and I need to dispose of this needle still. So I normally would have a sharps container in here. So my partner's gonna grab that for me. I'm still here watching my medications. All right, so I'm disposing of that. So you want it to be good. All right, so those are done there. And now I am going to do my next saline. And I want to do a 5 flush. So I'm gonna grab a 5 out of here. And I'm keeping my eyes on my medication. I'm in the medication room, but still, you just never want to take your eyes off of it. So now, I'll wash my hands again here. Okay. So I did my 3 mil, and now we're gonna do my 5 mil. The first thing I'm gonna do is clean off my vial right away, because you want to make sure, even though you're drawing out the same thing, you just want to make sure that they're both clean for the patient. And we're going to need a filter needle too. So I'm going to put this here. Let me go like this. 1, 2, 3, 4. Alright, we're good on that. Let me get rid of that there, and I'm just going to open this up before I put on my filter needle. Alright, so that's clean. that. Take this out here, keeping sterile technique. All right. So we're sterile there. Throw that away. So don't want to throw that away. All right, so here we go. Put it directly in there. We're gonna get 5 mils here. Just wanna make sure I'm getting that fully. All right, so we have 5 there. Oh, there's a little bubble. Break that bubble up. You don't want that in there. All right, so we're good at 5. All right, so I have my cap here. I just want to make sure that I'm going in straight on here. And we're okay. All right, good. So that's done. I'm going to disregard my gloves here, and I'm going to put on my saline flush right away. I already double checked my saline against the MAR here. We'll do it one more time. This is just extra stuff. You want these. This goes here. All right. So I have my hydromorphone. I double checked that with this expiration date, medication name, allergies, no allergies. 1 mil I drew up because 1 milligram. And then I have my salines here. I have my 3 mil and I have my 5 mil here. So these are both good. I'm going to double check against my MAR here. So we have expiration date, good. Saline, yep. NSAIDs, nope. All right. So we're all set to go. I already double checked my bags. And the last thing I'm going to do in here is label my Tegaderm, just because we can have all our labels ready to go. All right, so we're going to put 3/29/19, and then I'm going to put the time, and this is 7:38. We'll be giving them at 8 a.m. And I'm going to put my initials here. So I have that all ready to go. All right, so just some leftover supplies that I can leave in here, and I'll grab all of this stuff. All right, we're good. So now we're gonna come in, pretend like I haven't came in yet. Just gonna set my stuff down so I can properly do it. All right, so first thing we're gonna do, here's my gloves here. Put this Tegaderm over here. All right, so I'm gonna come into my patient's room and knock. I'm gonna wash my hands, make sure that the privacy curtain is closed. I'm gonna say, hi, my name's Taylor. I will be your nurse today. And I'm gonna bring this over to my patient. Check his names, James Wilson, okay, 5/12/1952, 5/12/1952. And it looks like your allergy is NSAIDs, okay, do you have any other ones? No? Okay, so he's good. All right, so I'd explain to my patient, basically what we're gonna do today is I'll be giving you some IV medications for your pain and your pneumonia. So I already checked all the compatibilities before I came in. So the first IV push med that I'll be giving you is hydromorphone. So I'm giving you this because your pain level is greater than a 4. You said it's at a 6. So I did vitals, checked respirations before this one. If it was less than 12, then I would not give it and I'd call the provider. So, all right, so hydromorphone is used for moderate to severe pain, like I said. Side effects, you might feel a little drowsy, dizzy, or have a decreased appetite. And with this med, you should stand up slowly, avoid tasks that require high alertness, and avoid alcohol, which we're in the hospital, so you're good. The next one I'm going to be giving you is sodium chloride, and so that's for fluid and electrolyte balance, which that is basically just hydration, and we want to make sure this will help you with any muscle cramps, moisturize your membranes, like your nose and your mouth, balance out your fluids in your body. So that'll be running through your IV, and then we'll watch for any facial flushing, fever, and irritation. Okay, the next one we have is levofloxacin, or Levaquin. Also, I want to make sure that he knows that hydromorphone is also called Dilaudid. So levofloxacin or Levaquin. This I need to watch for any sensitivities. Again, I made sure there's compatibilities between these. Alright, so Levaquin is used to treat your pneumonia. Some side effects we might see are diarrhea, nausea, abdominal pain, dizziness, drowsiness, or a headache. I want to watch for any colitis or super infections, and I just want to tell my patient, let me know if you have anything that you feel during this process or after. Okay, so now I'm going to do my third med check. I just did my first and second one. So I'm going to wash my hands here, and we'll start at the top. Alright, so we have our 500 ml bag of 0.9 sodium chloride continuous IV. Yep. Okay, right patient. Okay, May 2016. Pretend it's not expired for the video, but it is. Never would give that to a patient. Levofloxacin, okay, 250, 50 mils, 0.9% sodium chloride IV daily. Not an allergy with this one. And it looks like the expiration date is September 2019. Next we have the hydromorphone, and that is 1 milligram per mil. Double checking here, I did draw up a mil, okay? So I have a mil there, and 10-10-25, not expired, and not an allergy for my right patient at 7:30, 8 o'clock. Okay, and then I have my 2 saline flushes. I have my one that is my 5 milliliter, okay? And then I have my other one that is my 3, good, and I want to double check on here. Saline flush, expiration date, good, we'll say 1 October, yeah, expired again. Allergies, NSAIDs, not an NSAID, right patient. Okay, so I think we're ready to prep my patient. Alright, so the first thing I'm going to do is open up my extension kit, or my start kit. And the whole time, like I said before, I'm just going to be watching my medications. Like, even though when I was here, I still could see my medications. So no one tampers with them. Okay? So I'm going to say, all right, Mr. Wilson, I'm going to put this tourniquet underneath you here. All right. So the first thing we're going to do, like I said, wash my hands here. I'm going to put on some gloves just because we're touching the patient. All right. Put my gloves on here. All right, so pull this and keep that tight. All right, so I'm palpating for a vein, assessing no bruising, redness, anything. This is a good vein here. Radial pulse is good. All right, we'll use this one. It's your non-dominant arm, so that's good. And then before I alcohol wipe, I'm just going to change this because I want to make sure that these are clean. All right. So I'm going to alcohol wipe his arm for about 20 seconds here. And I put the tourniquet about 4 to 6 inches away from the site of injection. Okay. Now I'm going to just go 1, 2, 3, 4. In to out. You never want to go from out to in. Okay. I want to clarify that I did my second med check, first med check, second med check, just did my third, checked allergies, checked over everything with my patient. Did a good 20 seconds there, so we're going to let that air dry for about 2 minutes. Alright, so I'm going to bring my medications over here because this is where I'll be doing my stuff. And I like to put them in order just so I know what I'm giving. Don't touch the patient because he's sterile. This I'm going to just set over here so I don't have to worry about it. These have been checked, keeping them in my sight the whole time. All right, so what we're gonna do now is, I think I'm gonna stay on this side. Just move this over a little bit. All right, so my patient's still doing okay. I explained the procedure. We're gonna just give you your IV here. I'm gonna push a few meds and then I'll connect it to this tubing on here. So one thing you wanna do is make sure that your patient, well, I guess I'm not there yet, but you wanna make sure that they know it's gonna be a slight sting prick with the IV going in. But all right, we're gonna put in the extension set now. Just kind of get this prepared. And you don't want to touch anywhere in the inside of that because that's all sterile. Okay, so this is all sterile, like I said. The cap is on there. This is good. I'm going to connect my first saline here. So what I want to do is remove this lock, put it directly into the sharps. I'm going to nicely grab this. I'm just going to put those together. Oop. Make sure that's good on there. All right, so my first saline, oop. This wasn't the first saline I wanted to do though. Okay, so these are both still sterile ends, but we are just going to do, let's do this. I can set it down because they're both still sterile. I only touch this part here. So I'm gonna take off, take off this one first. Okay, so this one is probably no longer going to be good, but if I keep it sterile, I can put on this cap. So this is all still sterile, it's okay. All right, so I'm just gonna put that on there. So that's okay. Everything's still sterile on this one, so I'm just gonna set that aside and get my 5 like I said. So take that off, put it away, grab this, it's okay. Just gonna balance against here. Oh my gosh. Sorry, I'm very shaky, as you can see. But I'm happy I could problem solve that. So we're okay. All right, so that's good. I'm good to go. All right. So the site is ready, prepped, and I'm gonna wash my hands here again. One more time, grab my gloves, still watching my medications while I'm doing this. All right, so now what we wanna do is we're gonna put on the tourniquet, but only for 2 minutes. I wanna have my Tegaderm ready here. It's all still sterile. So that's ready. Throw that away. All right, so he's sterile, got my needle over here, and we're ready to go. All right, Mr. Wilson, so I explained to you this procedure, cleaned the area. Now I'm going to give you a little prick here. Don't want to touch that hub, make sure everything's still sterile. All right, so I'm gonna pull down the skin here, keep bevel up, 10 to 30 degrees. And I got flashback. So what I'm gonna do is I'm gonna drop down the catheter, go in another 1/4 of an inch, and then I'm going to advance my hub without touching. It's got a little ledge on there, so that's nice. All right, now I'm going to occlude. I'm gonna shut that off, the thing. Okay, good. Needles, sharps. And then I'm going to grab onto here. Make sure this is all still sterile. Tourniquet here. Make sure not to touch that hub. I'm still occluding. And I can connect this in a second. We want to stabilize and advance that. All right, so get it nice on there. Good. Good. All right, now I want to hold this here. Still not touching the hub there. Good. All right. Then I already took off my tourniquet. I'm gonna tape this first. Make sure this plastic's not in the way here. I just want to kind of move that for him. Okay. So now I have all this stuff on. I'm just going to take off this. I gotta keep these on for injection. Oh, here. I was like, what is going on? Okay, good. Then I'm going to grab this off of here. All right, so that's good. You don't want to put it over the injection site. All right, so we're good on there. Try to keep it off the skin there. So now that I did that, I touched the patient a little bit, so I'm just gonna wash my hands here. All right. So the first thing I'm gonna do is I'm gonna push the saline to the top here. And what I did is I already taped it, but just to make sure that it goes to the cap here. We're just going to bring this off for a second. Just push this. It's only saline, so I'm only going to go in at about 2 mils. Should be good here. So basically, I just want to make sure that I clarify this in my video. When I prepped the extension set, I would have put it up to 2 mils so there would be no air embolism. Okay, so we'll just say that I did that. I think that's okay as long as I clarify that I did that. So I pushed this one in 2 mils, and then I would go with the whole saline flush. I'm not going to put it into this arm, but okay, so that one's in. I'm going to do my hydromorphone here. And if this blue part were to touch anywhere on the arm, I would have to clean it off, but technically we do not need to do that for Cassie's. In practice, we probably would, just to be safe. Okay, and my hydromorphone I'll be putting in over a course of 2 to 3 minutes. Okay, so we'll say I put in that one. And my second saline here, I'm going to put that in over the same course as I did to the medication. Again, keeping sterile technique. Good. I'm going to push that in over 2 to 3 minutes, just like my medication, and I should be good on that. So, now that I'm disconnecting this, I will have to clean that off, but all right, we're good with that. So now we are going to do the tubing. Make sure my patient's doing okay also. All right, so he's good. And next we are going to want to bring this over. All right, so the first thing I'm going to do is prime my primary line. Patient's doing good, tourniquets off, Tegaderm's on, labels on. All right, so my primary line here first. One important thing we want to do is make sure that all the clamps are shut. It's more important on the secondary, but we just don't want to lose any fluid. So, take these off here. And all this is still sterile because it all has its caps on. Okay. So right away, this is shut. This one's shut here. Maybe I'll bring it up more. So it's right up next to the drip chamber here. Okay, so I'm gonna get my primary bag here. And the first thing I'm gonna do is take off this cap, and I can throw this. Have this one, take it off, keep it sterile. Not wanting to touch any of that. And I'm going to spike the bag here. Make sure you don't touch those sterile ends. Okay. Looks good. All right. Then I can flip it. This is also sterile. Hang it up here. And the first thing I want to do is fill my drip chamber halfway through, full, halfway to a third. I can unclamp this. All right, and then I'm going to have my Minnesota. All right, so I'm going to fill up my Minnesota first. And then we're going to flip. Make sure all my tubing I'll keep going down here. Just gonna set this down. A second. Okay, so what I want to do here is I have all my bubbles out of my top, and then we're gonna flick these ones out. Make sure that that fluid's going all the way to the bottom. There's no bubbles in this one. Okay. Good, good. Just want to get these ones towards the end here. So my fluid, it's good to get gravity. And what you do is hold it like this. Okay. Okay, all the bubbles are to that one. And we just want to get this bubbles out of here. Make sure that doesn't touch anything there. And what I'm going to do here is I'm going to open up this cap here. If I keep it in my hand, it will remain sterile. Okay, this is getting out the bubbles here. And I still have this in my cap here. It's good. All right, so now what I'm gonna do is I'm gonna close this lever, and I'm gonna grab alcohol wipe. All right, I'll wipe this off for 20 seconds. Okay. And then, since this is sterile, we're going to put a sterile cap on there. Make sure not to touch any of that. Just balance on here. Okay. All right, so this is all on there. Primary has no bubbles in it, and I can set it right up here. Next thing I'm going to do is get my secondary tubing here. And so that's right here. Still keeping my medication in sight. want to do the clamp right away. Throw away that. Okay. And I'm going to clamp this up here. Okay. Then I'm going to grab my medication here. Pop that off. Pull that off. Keep that sterile. Spike the bag here. And we're good there. Okay, clamps on. Good. Now this next step, we want to be sure to be safe here. I'm just going to undo this for a second. Make sure this is out of the way. I want to make sure everything's clamped. That's clamped. And then we'll just clamp this part here. Okay, so I got that loosened, and I want this cap to go onto it, keeping sterility. Okay, and that's just saline, so we're okay. And we maintain sterile technique there. So we're good there. Turn that on. Okay. Boom. I'm here for time. It's okay. Alright, so what we're going to do now is I'm going to back prime. First I'm going to put on my labels here. Label, close the lever, make sure the clamps are done. Okay, other one, keeping my medications in sight. Put this on. Alright, so now what I'm going to do is I'm going to back prime. Get all those bubbles out with back priming. I have a little carbonation bubbles there. Yeah, those are good. And it's just getting that last bubble out there. All right. It looks like that bubble's almost out here. All right, perfect. All right, so now I'm gonna do my line A here. So line A is the first one, and that is at 100, and it's a 500 ml bag, so I'm gonna do 490, and I'm gonna click, oh, there we go, start, and then I'm gonna click stop, B. Now we have piggyback, so I want to do 50 ml, and we want to give the whole bag. Okay, good. All right, so I'm not going to start that yet. I'm going to bring this over here. It's all set and ready to go. I'm going to wash my hands. Grab some gloves here. And now I am going to wipe this off for about, let's see, 15, 20 seconds here. Okay, good. And now go up here. This is all sterile, so it's okay. And I am just going to take this cap off here. Okay. Attach it on. All right, looks good. Make sure my patient's still doing okay. Put it in a comfortable position, and I should be good to start my stuff. Yep, and then, so that's pumping B. 50 to 50 rate, in A 100 rate, start, and it's delayed. Okay, we're gonna just stop that because I don't want it to go into the arm. Okay, so now that's all done. So I would tell my patient, first wash my hands, tell my patient, let me know if you feel any of those side effects. I will be back to check on you in 15 minutes. Make sure safety, side rails are up because he's at fall risk. I have this, call light, call me if you need anything. He's in a comfortable position and safety's all good. So he's good in here, and I just go to my MAR. I've already washed my hands. Do it again here. And I'm just gonna document quick. We're gonna do 8 a.m. and it was 3:29:19, and this rate was 100 mils per hour. Okay, and then I have this one, and it's 8 a.m. 3:29:19, and that was at 50 mils an hour. Okay, and then my hydromorphone, I gave that at 8 a.m. on 3:29:19, and I gave 1 mil of that, and that was 1 milligram. And then I want to say I attempted one time, so I'll put 1 attempt, and then that was in his left forearm with a 22 gauge needle, 1-inch needle, and then TF. And I'm just gonna initial, sign my name. Okay, good. And then I'm just gonna say that I did give it at 8 a.m. and we're gonna do 3:29:19, good. And I had 1 attempt at my needle, and I used a 22 gauge 1-inch needle. And that should be it. I'll just initial that, and that should be it for my IV test out.